All attendees are in listen-only mode.
Welcome everyone. Thank you for joining the third in our series of Senior Living webinars. This is brought to you from Unity Connected Solutions and Status Solutions. Today's focus and topic is on resident mobility and in certain cases staff duress. Today I have with me Chris Prada, Regional Manager with Status Solutions. Morning.
Good morning. Thank you for giving me the opportunity to speak.
And Amanda Miller-Lau, who's our Senior Living Specialist at Unity.
Good morning.
Between them, they have experience of working with several hundred senior living facilities across Canada, both public and private sector, and large organisations and small facilities. So we can look at a broad spectrum of experiences and how they are using technology like the SARA system from Status Solutions. Before we get into the topic of managing mobility with senior living facilities, it might be worth sort of setting the context for this webinar and reviewing, first of all, just why people choose to go into senior living facilities. Perhaps, Chris, that you might want to kick off that topic, that question.
Sure. From a very high level, the key points that people are looking at when they make that decision is they're concerned about changes in their health. They're concerned about their security. Often it is family members themselves that are putting pressure on their loved ones because they see that they're not able to cope in quite the same manner as they had before. So with regards to specifics, with concerns about slips and falls, someone there to help them out with the basic chores of housekeeping and so on. But also a big piece of it is about improving and maintaining a quality of life, the ability to engage in new friends, new activities, and stay active.
So that's a good point, this notion of quality of life. We see that all the time, that we hear that from many of the people that run these facilities, that they're looking for ways to improve the quality of life of their residents. So perhaps, Amanda, you've visited many of these facilities and you've heard how some of the services being provided. Perhaps you might talk to the notion of quality of life.
Sure. So when a resident moves in, they can make new friends and participate in various activities. It could be from having lunch with their new neighbors to a wide variety of activities. At homes, I've seen, simple things as walk around the building or around a pond that's on the property. There's often a hairdresser on site, movie nights. There's posters for new movie nights up all the time. And sometimes you even see wine tasting or pool tournaments at homes. By wearing a pendant on the property, a resident can have the confidence that a staff member will respond to them when they are in need, and therefore they can do the various activities. They can walk around the pond feeling confident and participate in the activities that are available throughout the building.
Yeah, I remember I visited that one with you and they had pub night.
I did. You wanted to stay.
I did want to stay. So one of the topics that comes up, in fact, when we visited some, was this notion that life expectancy is actually increased so it's not just looking after, obviously they care deeply about their residents and the quality of life the residents have, but they also know that life expectancy is actually increased because they're participating more and getting out rather than feeling locked in their rooms.
Yes.
Yeah. So on the topic of feeling safe and secure, how does something like a monitoring alerting system help? I mean, how can that really have an impact on something like quality of life or a confidence in feeling safe, Chris?
Well, this actually talks to technology that's gone back a long way. Everybody has seen the commercials of fallen and can't get up. This idea that if I'm in trouble, how do I get help? When you get into a senior living facility, you have larger facilities, you have indoor spaces, you have covered spaces, you have places where people might be alone. This technology and technologies like this allow someone to be anywhere within the building and know that if they press a button for help, they will be found, whether it's in an underground parking space, in a laundry room, or even in their own apartment. So the technology is there now that covers not just an apartment or not just the building, but outdoor spaces, underground spaces, etc. It also gives the staff confidence that they can find the residents quickly, gives the family an understanding that they have some accountability as related to qualities of care that their loved one will receive.
So, so that helps us understand that notion of confidence, I guess, to do those things. You know, for residents who are independent living, but there are cases where now we have seen that people are talking about aging in place, not necessarily long-term care facilities, but true senior living or independent living, and they're looking at this notion of residents aging in place. Perhaps you could talk to that topic and what it means, and perhaps how technology actually plays a role in that.
So a retirement community can sometimes have many different floors in a building itself, but it can also be a campus environment where there's apartments or townhouses on the campus. So people can start on one floor or in one area, and they can move to different types. So if they start out as an independent living person, they can move into assisted living or get more care as required. And in some cases, some of the resident retirement facilities also have a memory care area. So residents can feel at home and they can feel confident that they can live there for the long term. By having a pendant, whether they're steady on their feet as an independent liver or as they perhaps age and maybe need a walker or something more, they will have the confidence that staff will be notified if there ever was a problem on the campus itself.
Yeah, I mean, I think that some of the places that I visited with you, one of the concerns they had were that some residents who needed that extra help, it might be that in the past they would have had to have moved to another facility, which would have not been great for the resident who now built up a set of friends and a familiarity with the site. So, you know, so we're seeing an increase in.
Yes, so you see some of the retirement communities changing their philosophy, so it's just not independent living. They've added more assisting living floors or giving care to the independent livers so they can stay with their friends longer.
And this technology helps to make the staff also more efficient, I would imagine, in those kind of scenarios as well.
Perhaps, yes.
So maybe some examples might help to put some of those concepts into context, and you know, talk to a couple of them that maybe address different aspects of how the technology works in these environments. Chris, you might want to.
Yeah, absolutely. I think a great place to start is actually the first facility we ever deployed in Canada. And it's a campus setting, over 80 acres, whereby we are monitoring and tracking all residents in this very large campus setting. There are people living in cottages and townhomes and villas. There are other people in apartment buildings. This particular facility actually has some assisted living. But the key point here is a large facility of 80 acres to be able to track people anywhere requires a unique technology. People look to GPS, but GPS does not work in building. It doesn't work underground. It doesn't necessarily cover certain wooded areas. This technology can cover the entire campus. We know where every resident is. They need help. We can direct them directly to the place needed, whether it's in their apartment or somewhere else. And as I said, that was the first facility entered into Canada going back about 10 years ago. Since then, we've become the leader in wireless solutions. A couple of other slides up here that are highlighting some other facilities we have. This notion of dine-in, check-in. The technology can free staff from daily things as trying to check on a resident, see who's come down for meals, see who's up and about in the morning. We have a facility in downtown Toronto that actually uses the mobile pendant. When someone comes in for dinner, the device is just scanned. So now I can tell who's shown up for meals, who has not, and therefore we can go up and check on that resident. So no longer is the need for the staff to call every resident or do roll calls or other extreme measures to make sure that people are showing up in time. The pendant itself is just tapped against a device, we know they're showing up for their meal, and we get a report.
So you're only managing the exceptions now rather than having to manage everyone.
Exactly, exactly. That same technology, by the way, can also check if someone's left the property. So if someone has left the property without signing out, we're able to know that. The third item here is a case study. I really like this. And actually, we have multiple sites out there in the cottage country where people are now able to engage in going for those long walks, walking around a small lake. We had one facility where they actually have a little boat, and we can actually track residents on the boat. So it opens up a whole range of opportunities of mobility, of being active and engaged, that without it, quite frankly, people will live in their room, will live in confined spaces. You know, retirement living is about living. It's not about, you know, being stocked away and hope that nothing happens to you. We want people out there being active.
So one last thought on it, because we talked about clearly the confidence it gives the residents themselves, and which allows them to be freer in terms of mobility, which lets them engage in those activities and therefore increases that quality of life. But one of the things, you know, we've touched on there is the efficiency for staff, because clearly, you know, you can make everything work by just having more and more people, but that's not cost effective. It's not possible these days. So we've seen some situations too where you tend to have maybe only 1 or 2 staff available, and there is some kind of a situation and they need to address it. They can't leave the resident, but they can't necessarily easily get help, right? So you know, they're caught in a catch-22 situation. How could this technology help in those cases?
Well, mobility and help or duress applies to everybody, whether, you know, you're a kindergarten child or you're a caseworker, or all the way up through retirement and senior living. So there's no reason that the help is limited to the resident. Staff can carry mobile devices that in the event that they're serving someone, they need help, they can call for help quickly. There's all kinds of tools that we can provide them with, whether it's smart tools or simple call buttons that allow not just the resident to call for help, but staff to be able to trigger, you know, requests for assistance.
So it's possible if a member of staff was carrying a device, that you can differentiate that was a staff member looking, therefore how you would respond would be different than, say, a resident. Or in fact, can you differentiate between residents?
So that's a great question, and that's really the point about our solution. The system provides unlimited rules, escalations, schedules, etc., that I can have things set up on a per resident or per individual basis. So every resident can have different alerting needs, can have different urgencies and response. So whether it's staff or a resident, you can have rules set up uniquely for that individual.
So it's a pretty comprehensive solution as opposed to a single device. So we're talking about mobility here, but it's really just one aspect of the full picture, right?
Yeah. So the point there is, you know, often people think of devices that is a device into itself. Press a button, I get help. This is more than just the mobility piece. In the back end, there's a server with rules and escalations and structure designed to automate, to monitor all health, security, environmental issues related to the entire facility. We're talking about one aspect. Obviously, the series covers all of the other pieces. But the pendant is a small piece of a bigger solution that allows the ability to provide those unique rules, direct staff to where they need to go, and so on.
So just on that topic of the pendant, I mean, just so people can get a feel for them, these images aren't doing it justice, but there are a variety of options there that these things can be carried. How do they use these pendants, Amanda?
So there's 2 pendants, well 3 really, pendants that are available. The picture on the top is a large alarm button, which can be worn around the neck. It comes with a belt clip, and then there is an optional Velcro bracelet that you can use with it. It can be worn throughout the facility to give the location. A red light goes on when the button has been pushed, so the resident knows that it has been pushed. It's water resistant, but it's not waterproof. So that's the original pendant that we have in many facilities. The new pendant, as we call it, has been recently made available, and we've had to put in a few sites. It is smaller. It is two options to this pendant. You can either wear it around the neck, or it comes in a wristwatch style of pendant. It cannot be both. So it has a smaller footprint. It is waterproof, so you're able to wear it in water if there's a pool in the facility or in the tub. It has a vibration on it, so the resident actually feels how when the alarm has been pressed. How they're cleared are slightly different. You need to go to the resident to clear the device, which most facilities, that's what they want to do. The original pendant, you use the back of it and you clear it that way. The new pendant, there's different ways to clear it. You can either press the button in a series of presses, or there's an alarm clearance card that you can purchase with it, which is what facilities have chosen so far.
And that clearing of the alarm is important from a reporting perspective, correct?
Yes, so reporting comes with the Status Solutions SARA, and reporting is so important in many aspects of the pendant. So family members will know how quickly residents have been got to or been helped. It also helps the facility to see if somebody needs more care. If a certain resident has pressed the button a number of times in a number of days, they're able to go to the family and let them know that perhaps independent living is not where they need to be anymore, and they need more services, and perhaps whether it's more services within the building or moving to an assisted living floor, that helps with the reporting.
Excellent. So
It also helps with staffing. So the staffing of the facility, depending on how many alarms are pushed in a day, you're able to see how many staff members you need to have on within the facility, depending on the needs of the residents themselves.
So it's been used in a very broad sense, that reporting.
Yes.
So I guess there is another optional way of seeing the alarms and so on for staff now too. Is that right, Chris?
Yeah. We've been talking so far about resident alarm and about sending out an alarm. But what about how are those alarms being received? How are the staff made aware? The solution has a capability of pushing an alarm out to virtually any communication device. So I can send text messages, voice calls, email, I can light digital signage. There is a dashboard. So staff have many means of the ability to see what's going on. Our latest innovation with the advent of smartphones, with the rolling out of electronic medical records and so on, tablets and smart devices are more and more being accepted as a tool. So to that, Status Solutions built this application you're seeing on the screen now. It is an application that runs on a smartphone that allows the caregivers to carry a sort of command and control center in the palm of their hand. They can see all of the alarms going on. So every staff member is seeing what's going on. They can choose what events to accept by touching the Accept tab that you can see there on the right. And the other caregivers are able to see who is responding to which residents and where additional help might be required. This tool also becomes a two-way communication. It can be used as a phone, so they can receive incoming calls. They can call other caregivers. If they're serving someone and need help, they can tap a screen and jump directly to other people that are available. So this is an exciting new application, and as I said, as technology continues to be accepted with smart devices and tablets, we see this as being the future for providing caregivers the tool to know what's going on.
Well, certainly you can see from this it's much more visual and therefore less likely to be any confusion as to what the alert is, right?
Or who's being helped.
Yeah, and so you don't get multiple people going
to the same call. Yes, excellent.
Like the old code calls, right?
Yes.
So I guess the final chart we might look at is we've talked about a few things. Maybe to put the technology into context, just to show the architecture diagram. I hate showing architecture diagrams, but sometimes they can help to sort of get that fuller picture. We talked earlier that
right.
You can do more than just mobility. There's a series of webinars that are touching on specific aspects, but perhaps this might help to talk to that bigger picture.
Absolutely. So if you take a look at this screen, we start at the center, sort of the heart of the system is the Sera server. You see there the square, the red square in the middle of the screen. That server basically houses all of the intelligence, all of the rules, everything sits in there. It is a purpose-built server that's deployed on site that connects to all of the various alarm or alerting devices that may exist within the facility. Today we've been talking about mobile pendants. So these are wireless devices deployed across our network. You'll also notice there are door sensors. You will see other sensors such as wheelchair or bed sensors, window sensors, motion sensors. There's a host of sensors that could be added, again, to help people not only from a security standpoint, but from a life safety or an environmental standpoint. You will see other alarming systems. So the Sera server would be taking alerts off of your fire panel. We had a seminar earlier on this so that you can have faster response times. Sensors within refrigeration units and on boilers so that you no longer have to monitor and track these things. All of these sensors are generating what we call alarms, which is basically an event has occurred. Sitting inside the server, it takes this event and says, okay, what do I do with it? Rules and escalations and plans that you've built sit inside the server and tell the system, well, what do I do with it? Where do I send that alarm as an intelligent alert? An alert being giving more detail. Who needs help? Where to respond to them? What device is out of specifications? What wheelchair did someone slip out of? And we can then deliver those alerts to any communication device. So we can connect to existing phones, existing wireless devices, existing cell phones and pagers and walkie-talkies, etc. And at the end, you see the Sera eMessenger, sort of our new innovation to bring those smart devices into the world of monitoring and alerting. One of the things unique about Status Solutions' business model is the Network Operations Center, which you see sitting above all of this. You are dealing with a life safety environment with this solution. So 100% uptime is essential. And Status Solutions offers a service whereby we monitor the health of your server. So no longer do you need to check pull cords or check if devices are working. The system is checking itself, and our operations center is monitoring and alerting not only you, but your service providers, such as Unity, to be able to be on site to proactively deal with issues before you have a failure.
And even some of the things like, for example, devices that have batteries in them that will monitor those and tell you that could be sent directly to your own maintenance personnel.
Absolutely.
To quickly take care of those, right? So
Absolutely.
It's quite the notion of it being intelligent and determining what the particular alarm is and how to deal with it, I think is the most key factor of this system, right? That that's what makes it incredibly efficient for staff, right?
Absolutely. I mean, the key here is we're trying to get people out from behind the desk. The whole concept of mobility. We don't want someone sitting in front of a computer looking at screens. The concept here is the system is self-aware, self-monitoring, self-alerting. And it allows staff to do what they're trained to do, care for people. Let the technology deal with the mundane things, whether it's a low battery or there's a temperature out of specifications. The technology will manage that for you and then alert you or tell you when you need to take action. You don't need to have anybody sitting at a desk to look at a screen. Because ultimately, our goal is to be able to get people in real time as they perform their task out serving and helping the residents.
Thanks, Chris. So that really does end the session. We intended to make these 30-minute sessions. We do have 5 minutes. If there are people that have questions, we sent out a message over the chat to say send them in. Can we unmute everybody? We can unmute. So we're unmuting you. If there are some questions that you have, feel free to ask them, because we have a few minutes left and perhaps it's a chance to get them answered one-on-one, or you can reach out to us afterwards and we can certainly be more than happy to answer them. While you perhaps are thinking about that, just wanted to put down on the list here, these are we talked about it as a series. That we did one at the very beginning, and the second one we did was fire safety, and there's actually a recording for those available on the same page you went to for registration now to follow up to this. You'll see that. This one will be recorded for future. The next one coming up is the topic of mass notification, and something that, as we've gone out to a number of places, they told us is very, very key to their ability to respond to different, it doesn't have to be always emergencies, but into different situations, and they're looking at ways to improve that response and be more, they may have them on paper, they may have plans, but looking to put them, automate them as best as possible. And then finally we follow that with environmental monitoring, and then the last one being security in terms of access to your building and cameras and door and so on, which are all part of that bigger picture. So if someone has a question, we've unmuted you, feel free to ask. If not, we thank you for coming, and we look forward to you visiting us on the next seminar on July the 7th on mass notification.
Any questions at this point?
Okay, well, thank you very much for coming. We're going to end this webinar and look forward to seeing you at future webinars. Goodbye.
Bye.